Moving through in our study of specialties, today we'll be discussing the specialty of gynecology, obstetrics, as well as urology. So with gynecology, this is going to be the study of the female reproductive system, whereas obstetrics is the study of pregnancy, labor, delivery, and postpartum, which is the period following labor and delivery. Now we have urology as well in this lesson. And remember, with urology, urologists will cater to both female and male patients. However, when it comes to the male reproductive system, they are the specialists that will treat our male patients. So let's take a look at the female patient and the menstruation cycle. What we learned before when we discussed this chapter earlier is that menstruation is the process of discharging blood from the lining of the uterus. You can see here in the picture what it looks like before the menstrual cycle versus after. Remember, the whole purpose in the uterus and what it does here is it builds up that additional layer of tissue in hopes of having a fetus to house. If there is no fetus to take place here within the uterus, that tissue, that extra lining, is then flushed through the vagina, hence the menstrual cycle. We have a term here that's called menarche, and menarche is going to be in reference to a young lady's first occurrence of menstruation, her very first experience with a menstrual cycle. What we're seeing now is the onset age of menarche is 10 to 15 years of age. Now, with every menstrual cycle, the period time will vary from female to female, but we do have an average of 3 to 7 days in which it lasts, and a regular menstrual cycle you can expect to occur once a month. Moving through into menopause, menopause is the term of the cessation of the menstrual cycle. And so we have menarche, which is the beginning of the cycle at the age of 10 and 15. We have the natural cessation of menstrual cycle, which would occur between the ages of 45 and 55. What is happening, as you can see here in the picture, that as the woman ages, she starts to lose the amount of estrogen, which is her a part of her hormones, starts to lose that level. As that level of estrogen starts to decrease, the menstrual cycles will start to slow down in their reoccurrence, and then that'll take us through the stages of perimenopause to postmenopause. Perimenopause is the transitional period before actual menopause occurs. That's when the estrogen levels start to slowly decrease. Once the patient has gone without a menstrual cycle for a period of 12 months consecutively, then we can say that this patient is in what's called postmenopause.